ICD-10 stands for the International Classifications of Diseases, and 10 is the latest version that's being used by most of the world. In fact, every country except for the United States is using 10. We're currently using 9. What it is it's a coding system that's used for billing, submitting claims to insurance companies from hospitals and healthcare organizations. So ICD-10, this is the third go-around. It's been delayed for 3 years now, and Congress mandated that it be effective October 1st of 2015. So there's every hospital in the country has to start submitting claims on that date, not before, not after, to insurance companies and to Medicare and Medicare in order to get paid. An important thing to realize with this deadline is it's not negotiable. If you're a hospital and you don't submit the claims using ICD-10 codes, you simply won't get paid. This is a huge impact, and it could devastate a hospital, even force them to close their doors because they won't have any money coming in. The impact of ICD-10 on hospitals, it means most of all a process change for the people that work in the hospitals. Significant changes are ensued by the physicians, because the physicians develop notes. The notes have contents currently that are coded by medical records people, and currently they're descriptive enough to pick an ICD-9 code. What they need to do is be much more descriptive so they can pick the proper ICD-10 code. Part of what you need to understand is the coding scheme means that the codes are going from 3,000 procedure codes to 70,000 procedure codes, and the diagnosis codes are going from 6,000 to 30,000. So a lot more codes, and you got to pick the right one in order to get paid. What hospitals need to do to be ready is really to plan and communicate to everyone in the organization. A lot of the organization, when they're planning this, doesn't think ICD-10 applies to them, but as you drill down, you realize that almost everyone that works in a hospital is documenting or coding a diagnosis or a procedure, and they need to understand, how do I change my processes in order to do that properly? So that means either more complete documentation or selecting the right code. A big thing hospitals need to do is understand the implications will be that it's going to be more difficult because you have more codes to go through, so it's going to slow people down. Hospitals are planning for a slowdown in getting bills submitted and getting claims denied, so they need to have enough cash on hand to expect a slowdown in workflow for a short period of time. So what's most important to prepare for this critical date is thorough testing. What a lot of hospitals are doing is they're setting up their staff to be able to do dual coding, enter both the ICD-9 and ICD-10 codes, so that they can get familiar with mapping the codes when they read a report and have the right 10 code that they used to put a 9 code in for. CareTech can help the clients by helping them understand what they have to do and laying out a very logical plan so that they're not overwhelmed. What end users need to do is really understand, what do I have to do to make this work, instead of understand the big picture and all the complexity. So you break it down bit by bit as to what it is each individual needs to do, and CareTech can help them do that.